Now, speaking of a thing that usually is not quite as transparent and doesn't spend money quite as well, healthcare in Idaho. The debate over Medicare reform. This comes by the Coeur d'Alene / Post Falls Press by Kyle Fanninsteel / Idaho Capital Sun. In a recent development in Idaho's legislative landscape, a complex Medicaid reform bill, House Bill 419, has been held in committee. The decision came after doctors and other stakeholders voiced concerns that the bill could potentially repeal Medicare expansion. The bill, which includes 11 new requirements, proposed new work stipulations, and a ban on Medicaid covering gender-affirming care for adults, policies that Governor Brad Little has previously supported. The bill's sponsor, Representative Jordan Redmond, argued that the legislation was designed to strengthen Medicaid by ensuring that those most in need maintain access to care. He suggested that the new regulations could help combat abuse and fraud in the program, improve the state's budget, and prevent wait lists for care. However, several of the nearly 36 people who testified to the committee countered that the bill seemed like a convoluted way to repeal Medicaid expansion. The bill is part of a broader push by Idaho Republicans to cut Medicaid costs, a $4.6 billion program funded mostly by the federal government. Redmond's bill follows up on the work by interim committee last year that was tasked with finding ways to save money in Medicaid. However, the committee did not come to a conclusion about how to restructure Medicaid funding. The bill's fiscal notes estimate it could save the state up to $109 million. However, if the bill's requirements are not met by July 1st, 2025, the Idaho Department of Health and Welfare would be required to repeal expansion by October of 2025. The bill would have also required agencies to try to cap enrollment in Medicaid expansion, either at 50,000 people or at the total number of adults on Medicaid who were disabled or at age 65 and up. This story underscores the ongoing debate over healthcare reform in Idaho and the potential impact on the state's most vulnerable citizens. Which, it's the hot-button topic that we all love to talk about, the medical industry, Medicaid, and insurance. The first one, I guess, the point here that longtime viewers will know we're going to highlight is Medicaid covering gender-affirming care for adults, which I would argue there's a lot of people in Idaho that wouldn't want their tax dollars to go to that. Granted, in all fairness, a lot of our funding comes from the federal government, so we might not be spending for most of our Medicaid, but we should still spend the money we get from the federal government responsibly. Governor Little's position on that is supportive of it, which is another thing to be aware of for future elections, wink, wink. But anything we can do to kind of decrease it, it's sad to hear that this seems to have been slightly mothballed. It's being held in committee, so it's not completely out of the pale, but that also means it looks like it hasn't been voted on.
Yeah, this is an interesting one. As someone who's used Medicaid in the past, our second daughter was born on Medicaid, and we've been on it at here and there at times before. I want there to be a safety net for people who need it. At the same time, healthcare is not a human right. You don't have a right to healthcare. Rights are things that
are endowed by a creator.
Right. You have a right to speak. You have a right to protect yourself. You have a right to pursue happiness to the best of your ability. You don't have a right to have someone else do something to or for you. I don't have the right to walk into someone else's store, take their things and leave because, well, it makes me happy. You don't have a right to walk into a doctor's office and say, "Doc, I got shot. You need to take this bullet out of me." Now, hopefully the doctor, seeing a gunshot victim, would go, "Wow, I need to help this guy. I took the Hippocratic Oath, do no harm. I want to help him. I will help him to the best of my ability." But once you get past that point and say, "All right, so how is this being paid for?" And the guy's like, "Well, I got no money." Well, now we have a problem because dude just took a lot of money and didn't. He stole the doctor's time. Now, I can hear what a lot of people say is, well, but doctors have a lot of money. They should be able to give back to the community. And while as true as that may or may not be, while doctors do make money, they don't make that much money.
Especially nowadays.
To be able to always just give all of their money away. And so, long way around the bush here. I think it's good that we would cut back on Medicaid expenses. Also, looking at Idaho's budget, the two biggest line items that we have are education and Medicaid, or health insurance, I guess, Medicare and Medicaid. And so if we want to reduce our budget, you mentioned it earlier, if we want to reduce our reliance on the federal dollar, then this is one of the biggest things that we can do is cut Medicaid programs. And it sucks for people that are on it. I get it. I've been there. But that should be impetus to get out of that position and get out of that situation.
Right. And to adapt that system that, there again, markets, they get used to it. If you sit there in the government, right, in the bottom level of people like, well, I can always get Medicaid, right? Well, what does that happen to other either good or bad insurers, right, that would have otherwise been there? Those low-level people that help those, right, that are in need at that level.
Yep.
What's the role of the church then? I would argue for a long time in America that was the role of the church. And also that's why you saw a lot of hospitals and doctors, right, that were funded, or different clinics, right, from gospel professionals. Granted, I can hear people, religion and stuff, but hey, in this case, I can say, don't worry about separation church and state. We're talking about the free market, baby. Because I would argue that that's where the church excels in that. You're like, well, what about the needy people? Well, the church. That I would argue that is both the role it should play. And even if you're a person who's a skeptic that's not religious, if we go back in history when the church has played that role in society, I would argue society functions a lot better when the state is not the main medical provider or takes care of the needy. The needy are for the church. But anyway, getting off my church soapbox there. Going back to funding stuff, let's just look at this and say, okay, yeah, we have $4.6 billion of it, that we're putting into the Medicaid program, and like John pointed out, it's one of our bigger things, and we've talked about it a couple times here on the show, that we're spending as a state. And also, I would argue for anyone else there that is a conservative, we want to be off the ropes and change of the federal government. We want to be able to pass laws that we believe that are just and right, and not to have some person or bureaucrat in D.C. telling us, no, you can't do that because the global world order doesn't like it. And so part of that is really making us financially free of that. And one of those biggest things is the Medicaid program. Now, then giving that double side, say we have all that money that we freed up, and maybe you say, okay, but it's free money, we should still take it. Okay, maybe you can make a case for that. 4.6 billion. Imagine all the road upgrades we could do in the state. Everything that we're always complaining, right, about traffic and things. All that can be diverted there. Maybe all the people, I don't agree with it, that are whining about public schools, right? You could put it there, right? Or even better, above all those other options and the most conservative of them, what if that 4.6 billion or whatever percentage of that comes from the Idahoan went back in your pocket? That then you could spend on your own insurance, or that you can invest in nonprofits that then could offer medical care to people that are in need, that could spend it way more wisely than the government. So anyway, with those things said, and me and John both getting off the pulpit, right? I did go and look it up real quick. It was voted in the Welfare Committee, a vote of 8-5 to hold the bill in committee there, which for all intents and purposes, I think has effectively shelved it. We'll see if anything comes of it. Here again, the legislative session, I think we still have a little bit. I think we go into March, maybe April. I can't remember when we end. So there's still time. It could get rewritten and brought out again. And there again, call your senator, call your House representative in this case, right? This is something that you passionately want or passionately don't want. That's also an option. Please let them know, because these are examples of situations where you should be involved in that discussion, and it has a huge effect in shaping things that I think shape a lot of us, that you're like, well, I'm not old. What does Medicaid do after me? Or I'm not poor. Well, no, that money and how the state allocates it affects industries. It affects the local economy of our entire state and the profitability of it. So there again, little plug. go talk to your representative, and also just be aware that stuff like this is trying to be moved. And also, here again, I would like to point this out, that Governor Little has previously supported stuff like this. Now, we all make mistakes, right? Previously could mean that he's had a change. Maybe he has, but I think from past things personally, Mr. Little likes to put his finger up in the air and test which way the wind is going. So I guess for those out there, you might want to be aware of that with our wonderful governor at the moment.